Thank you very much for this very kind introduction. I think I want to start with a big thank you on one hand side and a congratulations to Gary, Glenn, and really the whole team for a wonderful first day with so many interesting and very rich presentations. And I think we all the speakers who shared their experiences today, a big thank you. So thank you very much. But I want today, this evening, not to talk about the NHS, not about the UK. Also, you're right, absolutely, the UK is a lighthouse for the rest of the world, and Lon and I just discussed that you are really so advanced in the implementation in hospitals that other countries can really learn from you. But I don't want to talk about the UK, I also don't want to talk about Europe, even not about the US or something else, and I know you're all very happy about that. But I want to talk about the so-called rest of the world. Africa. The size of Africa is often underestimated. Would you have known that you can put Europe, India, China, in the US into that continent? 54 countries. 1.2 billion people, and in a few years, in 2050, it's expected to be 2.2 billion people. Estimations say that Nigeria will be the country with the third largest population in the world. So it's a really growing country with over 1,000 languages, not yet the GS1 global language of business. A big issue in Africa and the whole world, to be honest, is counterfeiting. In Europe, we have the FMD. In many countries in the world, we see that traceability is a tool to find counterfeiting. But Africa is specifically affected. And WHO studies say that 10% is really in the developing countries the normal margin. I can tell you that in some countries in Africa, it is up to 50 or 60% of all the drugs which are counterfeited. So a very serious issue. And the countries are in desperate need of action there. There are other things. Do we think we work in a difficult environment? Well, look at that. That's the last mile, how it looks like if you are working in Africa. That's really how the drugs are getting to the patients. This is inventory management. This is HIV tests, so really important diagnostic kits, and that's how they are handled today. So you can see that definitely things are not easy in Africa, and I and many others believe that we can make a difference, really. That's why a good year ago, we had our first regional conference in Africa, which was a big success. It was hosted by the authorities in Ethiopia, and we had 1/3 of regulatory bodies in the audience from all over Africa. A really great, enthusiastic audience learning about GS1 standards and being very impressed of the possibilities which are out there. As a consequence, we are seeing now the first regulation for traceability with GS1 standards. Ethiopia has a good month ago published their directive, and they have done this with our standards, which you should all know because they look very similar to the EU FMD. It's the GTM, it's the lot number, it's the expiry date, and it's the serial number. So that is what the Ethiopian FDA and the Ethiopian government wants to implement and wants to use to achieve traceability. And they have decided to do this not only for drugs, but also for medical devices. So a really good progress. The first country is out there and is moving forward and is doing that in a very realistic time frame and with realistic deadlines. It was already mentioned that now 6 years ago, WHO had put out recommendations for vaccines with GS1 standards. But now, just actually last week, we have big donor organizations who have put out new guidelines for global health commodities, that's drugs as well as medical devices. USAID, Global Fund, Stop TB, and the UN organizations, UNFPA and UNDP. They all request GS1 standards, and they request our whole system of standards. They identify the capture and the share. They want the GTIN, they want the GLN, they want it in a barcode, and they are also wanting GDSN, so data, product data, submitted to them via GDSN. And that is making a huge difference in the world, because they are buying billions of drugs, of medical devices, with the support of governments. For example, the UK government is giving these organizations a lot of money to help people in Africa. The need for controlled action and reasonable action has led to the development of a roadmap for traceability, which is our advice to governments that if they are looking into traceability, they should look into certain things like what is really what they want to achieve, what is the scope, what should be the timeline. And I must proudly say, when I showed this to the Chinese government 2 months ago, they said that's exactly what we need to really analyze our situation and to develop a good system for traceability. So we have in the moment a great opportunity in Africa. We have regulatory bodies, we have the creation of an African medicinal agency, and they are all very interested in fighting counterfeiting and improving the supply chain. We have on the other side donor organizations who frankly have the money and the technical expertise and want to invest. And in the middle are the GS1 standards, underlying are the GS1 standards. So I see really big opportunities to drive really GS1 standards in Africa in an environment where there's nothing today. And we have seen in Ethiopia that with the awareness creation, they are starting to think about really where can the standards help beyond traceability in other systems like we see it here in the UK. And we hope that the second African Healthcare Conference, which will take place in Nigeria in autumn of this year, will further ensure that we will see alignment, regulatory engagement, and we are proud and have also a certain responsibility because this conference is totally sponsored and financed by the World Bank, by the Global Fund, and by the American USAID organization. So another big opportunity to educate, to inform, and to share learnings. Because it is so important. Safer, more efficient care starts with a simple scan. And that's true also for the rest of the world. Thank you very much.